I'm Dr. Margaret Lafferty, live from the 2017 Hot Topics in Neonatology meeting here in Washington, D.C. I'm joined today by Dr. Beverly Brozanski. We're here to discuss her talk on perioperative handoff for neonates. Welcome, Dr. Brozanski.
Thank you.
Thank you for being here. Dr. Brozanski, can you tell us about the main objective of your talk?
The main objective was to decrease the care failures in the perioperative period for infants undergoing surgery in children's hospitals who belong to the Children's Hospital Neonatal Consortium.
And was this based on a study that you did?
Well, the Continuous Initiatives for Quality Improvement subgroup of CHNC dedicates themselves to develop multi-center collaborative projects to improve the care of infants. And since so many babies in our children's hospitals undergo surgery, we thought that the perioperative period was a good period to try to enhance our care. So, and since handoffs is a great point of issues with transition of care, often having problems with transitions of care, we focused on trying to develop a safe program for transitions of care in the perioperative period. And we did that by allowing hospitals to define who they wanted to be at the postoperative handoff. So at the local level, they got to pick whether they wanted a surgeon or a neonatologist, and so at the local center dictate their culture to decide who needs to be there, and then to develop a handoff tool and to develop a process for getting people to the postoperative handoff. And so once the centers developed that, then we turned them loose, and we had a baseline period of collecting care failures, which we defined as any event that adversely affected the care of the child in the postoperative period. Mm-hmm. And we divided it into communication care failures and respiratory care failures. So over a 12-month period, we were able to decrease the respiratory care failures and the communication care failures by over 50%.
Wow, that's impressive. How many centers were involved in
20
this?
centers
20
were involved,
centers.
And we measured their compliance with the staff presence in the postoperative handoff and the compliance with the use of their handoff tool, and we were able to get about 75 to 80% compliance throughout the course of the study.
That's great. Would you be able to go into more detail about your major outcomes?
Well, the major outcome was care failure. And so what we did for the centers was centers were able to share how they collected care failures. And so we had multiple tools that we posted on the IHI extranet. We used that as a tool for us to communicate across centers. And so centers had their tool and basically collected their care failures locally at the center, and then entered in the percent of care failures each month. And then we had monthly webinars where we shared the results, the compliance to process, and the outcome. So, and we shared that by center, CHNC center letter. So we were very transparent, so centers were able to see, who were the high performers and who were the low performers, and it kind of spurred on some conversation between the centers to say, well, what are you doing? What are you doing? And I think that all the centers who participated really enjoyed that collaboration and were able to learn from each other, and it was very successful. We were very happy.
That's great. Was there one particular aspect of the handoff process that really stood out to you as making a difference?
Well, I think where centers struggled was gathering that interdisciplinary collaboration. We needed somebody from anesthesia and somebody from surgery and somebody from the NICU. And so I think what we learned was once you get over that barrier to get that collaboration, then it was like a dam broke loose, and then everybody kind of understood how much better things were in just the general communication process. And I think everybody felt pretty satisfied that we were, giving patients better care. And it did show what the outcome of decreasing in ARC communication and respiratory care failures.
That's great. What would you say is the major takeaway point that you want the audience to take away from your talk?
Well, I think the take-home point would be that if you get a key mover in each discipline to work with you and gain some groundswell with your frontline care providers, that the sky's the limit, and we really can work together to improve patient care.
That's a great point. Thank you very much, Dr. Brozanski.
You're welcome. Thank you for having me.
Absolutely. That's it for us here at the 2017 Hot Topics in Neonatology meeting here in Washington, D.C.